outcomes for patients with NMDA receptor encephalitis have not changed over the last decade. We need your help to refer newly diagnosed NMDA receptor encephalitis patients who may be eligible to participate in the NIH-sponsored Extinguish trial. The Extinguish trial is now enrolling new NMDA receptor encephalitis patients. To learn more, search Extinguish trial at clinicaltrials.gov or call the Extinguish hotline at 844-4-BRAIN-5.
This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
This is Stacey Clardy, and today I'm speaking with Natalia Rost. And Natalia is President-elect of the American Academy of Neurology. She's also the Chief of the Stroke Division at Massachusetts General Hospital and a researcher. Her research focuses on post-stroke cognitive impairment and dementia in diverse populations. And given this expertise, Natalia recently testified in front of Congress on July 18th, 2023, specifically to the Subcommittee on Health, which falls under Energy and Commerce. And you can actually look that up and watch the full testimony. The meeting topic was Innovation Saves Lives, Evaluating Medicare Coverage Pathways for Innovative Drugs, Medical Devices, and Technology. And you can find that if you just Google it. Today, we've asked Natalia to join us to talk about the experience of testifying in front of Congress as a neurologist and why it really matters to all of us as neurologists. So, Natalia, thanks for joining us. And to start out, can you tell us exactly what issue were you asked to comment on and what did you speak to?
First of all, thank you for having me. I think in one word, this is about the future of neurology. The issue specifically that we were asked to comment on is the availability of the anti-amyloid treatment lecanemab and the Medicare coverage determination in this case. But I just wanted to highlight that on the line is really the future of neurology, where the pipeline of breakthroughs and innovations is currently evolving, and we truly need to be hearing the voices of neurologists on the Hill, explaining why is it important for our patients to have access to these medications, innovations, devices, and other therapies.
Why does this issue have their attention? So really, I guess, what are the implications of lecanemab and similar therapies coming down the pipeline for the practice of neurology, especially in the eyes of our lawmakers in the U.S.?
This is a testament to the very strong advocacy work that the American Academy of Neurology has been doing with regard to the practice of neurology, and specifically the practice that is currently evolving with all these new therapies and devices coming through. We were invited because our advocacy team has been knocking on every door. As you know, the Brain Pack that we all heard and seen their presence at the annual meetings, the Brain Pack is really working on our behalf and trying to explain to the legislators how important it is for our patients, who are really the constituency in their home districts, receive those medications. So the issue at hand is actually the coverage for lecanemab, which is a medication that's been specifically developed for treatment of amyloid. As you know, amyloid-targeted medications have just recently came out, and the first one, aducanumab, is the one that created a lot of controversies with the Center for Medicare and Medicaid Services, or CMS, paying a specific attention with regard to how payment for that treatment will be covered. In light of the aducanumab rollout, the American Academy of Neurology has been monitoring how the CMS determined its coverage. There's a process that's called National Coverage Determination, or NCD. And as part of that National Coverage Determination, they've identified the particular drug as a medication that would go through a special process, which is called CED, or Coverage with Evidence Development. As part of this CED, which is a unique pathway, providers who are administering this medication also required to enter additional data into CMS's developed portal. That's obviously burdensome, and for some neurological practices in the United States that are overwhelmed with other neurologic care, that may not be feasible, in some way limiting access to the medication. Lecanemab, which is a second drug in this category, has also been a subject to this particular pathway, which is called NCD with CED. And the American Academy of Neurology has been concerned because of these two issues. One, the first drug and class effect that initially was applied to aducanumab now being applied to all of the drugs in this particular category. And second, for the patients who actually meet the criteria that seems to be of reasonable clinical and statistical benefit, they should be able to receive a drug without additional burdens and have patients get access to the medication.
So if I'm understanding, you were really speaking to Congress about the drugs in this class, right, that we're currently authorized to use to treat specific phenotypes of Alzheimer's disease. And you were saying, if you're going to allow us to prescribe these appropriately, can you reduce the burdens that are in place to making that happen? Am I understanding correctly?
That's right.
And so then, is this now under discussion? What's the timeline? Will we hear back? Do they take your testimony and consider it? And what's the plan going forward?
So this was an exploratory hearing of the subcommittee, and we hope that the next step that the legislators will do is actually proceed with the particular legislations. But the fact that we've been able, as an American Academy of Neurology, to hear our voice heard on the Hill, it means that it opens the door of opportunities for us to talk to specific legislators, and also hoping that not only the pressure for this particular issue that we were advocating for, but also for the future issues that may be affecting the pipeline of neurologic drug developments or perhaps other neurological issues, such as neurology workforce, that we've been hoping to hear that issue on the Hill, and we finally did, is going to become something actionable.
Right. And so if I understand what you're saying, this was a great opportunity. You testified, the staffers who work for the Brain Pack in DC will be following up. And the hope is that this is the beginning of a wider process where they've heard from you. They know they can hear from more neurologists on more issues, and that it's always going to be valuable. Is that the idea?
I think so. And this is a first opportunity in almost a decade for the Academy to hear its voice on the Hill. And this is not just a moment, but actually, in some ways, it's a movement, because we really do need to speak up in one voice for the future of neurology. As we know, with the aging of the population, with the environmental impact on neurological health, we're anticipating a slew of global burden of neurological disease, and that we as a neurology workforce need to be prepared to deal with it, and also to be proactive in many ways. And one of the ways to anticipate some of these issues is to move the legislation through the US Congress and, of course, through some of the global bodies of neurological professionals.
You know, I don't think many of us go to medical school with a plan to testify in front of Congress, but I think you make a strong case for why it is important. And I say Congress in the US, but certainly internationally, these issues are being addressed in a similar way. So can you tell us a little bit about the experience? I'm curious. So what surprised you? Especially, I know you've done the Neurology on the Hill opportunity that's offered annually, but how did this compare? And was there anything really that stuck out to you and surprised you?
Yeah, I definitely wasn't prepared to testify in a Congress on the spur of the moment, but I am very grateful and very excited to have had this opportunity. I have to say it was mildly terrifying, but also incredibly exciting to fly into DC on a short notice and work with our outstanding advocacy team at the AAN's DC office. I wanted to give a huge shout out to Sukhjit Ahuja and Amanda Becker and Max Goldman and the rest of the team who prepared me in less than an afternoon, offering a folder almost 400 pages in length, and basically prepared me for a bipartisan crossfire. But what really surprised me when I went into the hearing is that despite the political differences, how concerned about the innovation and access to care members of the Congress were on both sides. And that was reassuring in a great extent. And I'm really hoping that this is just one of the many other opportunities that the American Academy of Neurology will get to speak to the legislators in the future.
I've had this sense that there's just a ton of work that's done, and I've been to Neurology on the Hill a few times, and I've noticed all the preparation that goes into it, but that's something to hear that they had 400 pages of documents ready to go for you. And I guess it's reassuring if someone listening is the next neurologist called up, that they'll be really well taken care of and supported by the Academy of Neurology. And also to know that I think what I'm hearing is I could reach out to them and ask for help or education on some of these issues. Is that fair?
The entire advocacy team is really standing by 24/7. In fact, I'll give you an example. As we were preparing for the hearing the next day, late that afternoon, the CMS announced change in their policy on amyloid PET. You may not know if you're not in the specialty, but there's been a long-standing policy of coverage of a single lifetime PET in a patient's evaluation that would be covered. And the same night, as we were preparing to advocate to expand that policy to open up the opportunities for diagnostics, the CMS actually waived that restriction and allowed local determination with regard to how many PETs every patient receive. But this was almost like in a movie where you're sitting and you're preparing for this big brief, and suddenly you get this, wait a second, I'm getting a text with regard to that. And one of the Maxes on the team, Max Linder, had to quickly investigate the issue and come back and educate us, basically ingest pages and pages and pages of CMS report and brief us with a bullet point. So then when I go in the morning to the Hill, I was prepared to address that particular issue. It was very exciting. And, seeing that kind of advocacy teamwork in action was probably one of the most inspiring moments in collaboration with the Academy that I've had over the years. As you know, I've worked on the science and education side of the Academy for many years. I've been part of the advocacy efforts, both through the Neurology on the Hill, as well as the AAN's Legislative Summit. But this is something really unique and a deep dive, very dynamic, very high impact involvement was really the opportunity of a lifetime. And I just wanted to say regarding the advocacy, to some extent, advocacy in neurology is somewhat of a political activism. And I think a lot of people who are, just taking care of the patients or doing research are not necessarily comfortable or don't have time or, haven't considered this opportunity. This is not something we learn in medical school or in our postgraduate training. This is something that most of us don't even think about. But we're fortunate to have the AAN developing a very strong and robust expertise in this field. And I think everybody can contribute in whatever potential way. Do participate in Palatucci's leadership forum. If you have an opportunity, get engaged with the Neurology on the Hill. And if you have an opportunity, attend the AAN Legislative Summit. Those are the opportunities to engage at the higher level, at the national level. But there's also an everyday activism that doesn't have to take a lot of energy or a lot of bravery. You will receive emails from the Academy, particularly from the Brain Pack and your advocacy team, to vote or support particular issue. It's a grassroots movement. We really need it. We really hope that at some point, patients will be engaged with us as well, because patient advocacy is very impactful. But at this point, professionals such as neurologists and other neuroscience professionals are the ones who can make a difference with a simple click of a button from your computer, which goes directly into your representative's office. So there are ways to contribute, and I hope that the colleagues that are listening in the United States will have an opportunity to do that. And for our global colleagues, there is also growing opportunities to learn these advocacy avenues. We know that in the upcoming AAN Legislative Summit, the current president of the European Academy of Neurology and also World Federation of Neurology will take part.
And as you said, it's not something we get an education on, but it is so important to our ability to bring treatments to the patients. So really essential. And I will say, when I was a resident and, working many, many hours a week, I still did at least click on those emails and send them to my local legislator. So that was an impactful thing I felt like I could do with 2 minutes in between pages. So it's a great point you make. Thanks again, Natalia. I appreciate it.
Thank you.
This is Stacey Clardy, your podcast editor. Thank you for listening and for letting us join you on your commute, while you're exercising, or even while you're brushing your teeth. This has been another episode of the Neurology Podcast, your best source of practical, relevant, and timely information for neurologists, clinicians, and patients.